Welcome to the Undiscovered Gems podcast, hosted by NBA legend and business powerhouse Charles D. Smith, highlighting today's best and brightest business minds.
Good morning, good evening, good afternoon, wherever you are. Welcome to Undiscovered Gems. I am Charles D. Smith, and I'm your host. And today we have Dr. Ann F. Creekmore. Dr. Ann is a licensed clinical psychologist for 40 years. She's a multifaceted therapist, and we'll talk a little bit more about that. And she's got a book that she's written that you can get now, and it's called Love Yourself, Love Your Life. Dr. Ann, how are you? Welcome to the show today.
Great. How are you, Charles?
I am doing very well. You know, reading your background and seeing how many different types of modalities and types of therapy that you do for people with all sorts of different varied backgrounds. I'm eager to find out how you got there, but just kind of start off. Tell us, how did you become a therapist?
Well, I was always interested. I mean, even in psychology, I know when I was even 12 years old, I'd be reading Freud and Jung, trying to analyze my dreams with Jung's dream symbols, interpretations. And I just knew I wanted to be a psychologist from an early age. So I graduated from college in 3 years and just went directly into in psychology. I did all my electives in psychology. And then I went and did my doctorate, in clinical psychology in 4 years, the time you could do it, and even completing the dissertation. I just, was so interested in it. And over the years, I've done so many continuing education units, traveling to learn the Bowen family systems, the family therapy, the big, all the effective therapies, just go for monthly things to learn that, or monthly to learn the psychodynamic or psychoanalytic, like how to heal the emotional wounds of the past, just constantly studying. And as well, I'm interested in kind of the wisdom of the East and the West, the spiritual psychology, like Carl Jung, and, attending and doing all that as well, to kind of fuse them all together and use them all in an eclectic model.
Wow. It seems like you're a lifelong learner, and you're probably still studying and educating and learning in your craft.
Absolutely.
That-
I love it.
That's awesome. Let me ask you, has there been a personal experience at all that kind of led you this way? You said you read Freud and a lot of books growing up, so it was more academic, just your thirst and curiosity about the mind. Is that it?
I think so. And I think that also, that I had a lot of compassion for people. And, if you see people struggling, you want to help them.
Hmm.
And, so I think, it was a combination of
Got
just
it.
being interested and then wanting to help, knowing people need help. And how do you do
Right.
it?
Right. So talk about your practice. As I mentioned at the start of the show, you work with people with varied backgrounds. It can be from a chronic illness, physical illness, to mental duress, or even social changes that people need to make. It just goes. It's in so many areas. I haven't seen a psychologist or a therapist that's able to work with so many backgrounds. How do you do that? What's your method behind that?
Well, it's like I said, that I, studied so many different, I was interested, like you said, in the knowledge and understanding.
Hmm.
And that's basically what I've done. I mean, I've been a psychologist, forever, and I've had a very thriving practice. And and I have always been open to having anybody come. I mean, and I take all the insurances, so I've done the Medicaids and the
Mm,
Medicares and the, whoever, the EAPs, people coming in crisis, maybe need some short-term
sure.
disability to get through, and so on and so on. I just, and I've, worked out of where I work, my city that I work in, Richmond and Henrico. And so I've done this forever and have a wide network. I don't feel alone. I know the
Sure.
doctors or the integrative doctors or the, other therapists that maybe have a specialty, and maybe it's not my specialty, but we can we can coordinate. So, I don't feel afraid to help people. I feel like, or get them into a support group, like a AA group. I know the resources and just help them kind of social working as well as being a psychologist and doing the therapy, the psychotherapy in the different areas, but also just networking them with other sources. So we
Hmm.
do it a lot. Then you get good at something, right? And I've always
Right,
wanted
right.
to do that. My family, my children and family and so on, and busy with just working.
Sure. Is there any is there any strength that you have treating patients or clients versus uh, other therapy or psychological work that you do? What do you have a certain strength that you say you're best at doing X?
Well, like I said, that I do have an eclectic model, which does bring in most of the schools of thought in psychology or the types of therapy that I have
Hmm.
training in. I mean, I wouldn't be doing things unless I'd gone, to the workshops and done the training and the supervision. But I've done that. So I bring most of them um, in an eclectic manner when it's time, when it seems like if someone's being triggered, well, then we need to go deep and look at the wounds from the past. Or if they're having communication problems, we'll work on assertiveness training, on healthy communication, whatever it is. I
Sure.
reach from all of the training that I've had and just bring it in at that time. Um, I do hypnosis as well. When I was doing my internship way back when at the University of California, San Diego, I went out there, which was fun. And my supervisor did hypnosis. So, of course, that's what I learned, as well as doing all the
Mm.
therapy. So I've always included hypnosis. And I think that's an extremely effective technique. It's not like, Manchurian candidate, nobody's doing any torture on anybody. Sometimes people get a little afraid of hypnosis,
Sure.
but it's really you personally putting yourself into meditation. You put yourself in a little trance, and I
Ah,
facilitate it by just saying, follow your breath and breathe in good, breathe out cares, and then go to a calm, happy water scene in your mind. And then when you get into that relaxed state, I give the positive suggestions from my kind of cheat sheet, I call it. We make a little cheat sheet of like maybe 4 things I want to work on. A lot of times it's
mm,
anxiety, depression, sleep, but it could be a certain phobia, or it could be, public speaking, it could be even procrastinating,
mm,
or lack of trust in relationship or flashbacks, whatever. And so that when they're in this relaxed state, the reason it works is because instead of their mind arguing with it, they're in beta,
hmm.
come in, they're not arguing with it. They're in this relaxed state, receiving it. And so if it fits with your value system, then, the suggestions that you hear, this positive, you're thinking positive thoughts or whatever for the depression, then you'll absorb it. You'll be able to do it and self-actualize it. So it's just a really nice, non-invasive, natural, quick fix, really effective. I know that it's
Mm.
recommended to do it like 4 to 6 times, maybe weekly, but may work right away. Or if it didn't last quite the whole week, you boost it like
Sure.
15 minutes as part of the therapy. So I would call that one of my specialty areas, to always add that as an adjunct to, the other psychotherapy going on.
Mm. Yeah, I noticed that you mentioned hypnosis and kind of calming the person.
Yeah.
Is that kind of the basis of how you start to work with anyone? You have to get them in a relaxed, calm state before you start to really do what you need to do. Is that kind of the basis of your work?
That's a good question. Something I really talked about. I'm not sure all my clients would say that. I mean, of course, developing rapport and being there for the person. I mean, that kind of relaxes them, and being able to listen and feedback what they're telling you, so that you know that they know you care and you're getting them. I do, but I would say the first session, what I do is an intake. And that's what we're supposed to do. It's coded differently
Mhm.
for billing. It's a 90791 compared to all the other ones, which are called the code 90834. And so the counseling really doesn't begin until the second session. For me, the intake is where you're supposed to do a clinical evaluation. So you're supposed to, so I actually, I mean, I have a very thorough clinical evaluation that I do when the person first comes. So they have to put up with a lot of paperwork and 1,000 questions. But I
Mhm.
really want the first time around to really get to know them, not just what they come in for. And I want their goals, and I want to know exactly what their complaints are, but I want to get a better, deeper understanding. I mean, if they're depressed, is it a unipolar depression, or is it a bipolar depression, a moody, low grade depression? Not it may be a full blown bipolar one, but it might be a lower one. And you don't want to mistake it for just a flat unipolar just because that
Sure.
day they're in it, when that some days they're also, trying to throw their bed down the step because they think it'd be a great idea to move into another room, and they're in a manic episode. And because then I'm working with their doctors, and if they have the bipolar depression, it'll be a different medication versus a unipolar. So, just for example, or um, if they have childhood trauma, did and occurred under age 8, could they have be on the spectrum for a dissociative disorder, a complex PTSD that could be the borderline personality disorder at the
Mhm.
descriptive level of what it is. But that's a
Sure.
different treatment as well. Even the hypnosis is a little bit different because you got to reach all of themselves, their internal family system, not just the life manager that walks in there. So my first session is a little deep on getting to know them in every capacity. I get their
I
total,
see.
psychiatric, educational, relationship, job, is, all their meds. They write it, so it doesn't take that long. I give them a little intake package and some questionnaires on different possible disorders.
Right.
If they say they're having it, then what am I going to say? They're giving me the information. So I don't know how
Right.
that is the first time, but it seems to be okay. That they seem to understand that you need to understand them before you get started.
Well, I think, I'm going to use the term coach at this point. When you talk
Yes,
about getting to know someone,
yes.
that is the start of a fruitful relationship. If someone who's working with you, coaching you, really knows your some of your habits, your behaviors, knows a little bit about you, that does make you feel comfortable. You can say,
Yeah,
"This person gets me," and I think that's
yeah.
important.
Yes, thank you. Thank you. And I like you
So,
bringing up the idea of the coach because I'm a pretty active therapist, and a lot of it is helping them maybe learn skills,
right,
be able to utilize skills they have, right? Resources.
right. Now, looking at uh, your process and this intake, that's a lot of work. And do you have a cutoff on how many clients you would see in a day? Because if I'm thinking that you're working with so many different types of people with different issues, that's got to be tough on you. Do you have a cutoff? Do you see 3 a day, 5 a day? Can you go 7? How do you manage that?
Well, it would vary from day to day. Like if I had other things that I needed to do, you know, but I mean, I can see a lot of clients in one day and it doesn't bother me at all.
Hmm.
I mean, I feel better, I guess, feeling like I'm helping somebody. It's a positive thing. It doesn't drain me at all to do that. So I can go way over your number on one day a week, for example, and maybe at the top number the other days.
Well, you hear some therapists and psychologists, you hear uh, them say it does drain them. I guess it's a skill to be able to hear and listen. You know, are you really taking it in, and is it becoming emotionally draining for you? So
Right.
I guess you have that skill and that art where you're actually listening and you're working with them, but you're not, I guess, beating yourself up over their issues. There's I
Right.
don't know, you can help
I
me with it, but is there a cutoff mentally or there's got to be a cutoff where it just doesn't go penetrate you to a certain point.
I think because I'm such a positive-minded spiritual person, I
Hmm.
just think that it's helping them, and that brings me, I'm happier. Like I always tell them, that because they are doing good, no matter what's going on. I mean, there are good things they've done. We just focus on
Hmm.
the positive, and when they're leaving, it's like, hey, you really did good with that, and you just feel free to call if you have something in between that you need me for, and people do that. So I've never had anybody, hurt themselves, kill themselves or some from depression or anything. I don't even usually have to put anybody in a hospital. We just kind of work out. I haven't, I just, somebody needs that. They may have already known that. And we go, we got a safety plan. You're feeling that way. You're calling me, right? You keep calling me and you're calling this one and that one. And I'll just get up. I remember a couple that would go to the hospital before they came to me, and I just got a phone call, Dr. Ann, I think I need to. I'm going into the hospital. I'll be calling you
Hmm.
as soon as I get there. So we have this kind of, in a way, just I want to be there for them. So, and I think they know that, and I'm always looking at the good of what they are,
Hmm.
seeing that good, and so it makes me happy that somebody's there for them to do that for them, and that they respond. It's they seem to improve and get happier, and that's what's important to me too. So I'm happy about seeing them.
Wow. Dr. Ann, you have a gift.
Thank
You know,
you.
when I hear somebody answer anything like that in their career, and especially if it's a career that could be stressful, it could be emotional draining when you're giving of yourself, and you're saying at the end of the day you're just happy and you can deal with a lot of clients. That turns into a gift. You just meant to do with what you're doing. So
Yeah,
I hear, it's one of those things where people say, um, if you find a craft or a career that you really love, it's not like you will never work a day in your life. And that's what I'm hearing from you.
exactly. That's true.
Uh, that's
Exactly.
the only way I can see it. The way you answered, like this is what you love to do. You love to help people. That's a
Absolutely.
real gift. Yeah,
Yes.
that is
Thank
a real
you.
gift. Let's move toward the industry a little bit. What changes do you see that have taken place, say, over the last 5 years in your industry as it pertains to, you mentioned insurance, treating clients. There's technology that comes into play. Do you use technology at all? Is it all just human intervention back and forth? What changes have happened in the industry?
Well, of course, I think with the pandemic, we were able to start doing telehealth, like a Zoom or Google Meet or, even phone, depending on the insurance
Mm-hmm.
company. So that's a big change. And that hasn't changed. We still can do that. So if somebody's car breaks down, for example, they don't have to give up their session that day. They can call and say, oh my goodness, my car just broke down. I can't get it going. I can
Sure.
say, hey, would you like to do a telehealth? That's fine. And that's a legitimate, way to provide a service. So, and you can reach out to more. I mean, I've had people over the years, of course, come from other cities, but generally they're in my vicinity. And now you can do a side pact and do it even across state, and have people, reach out to you. So you can reach more people. And
Mm-hmm.
um, so, and I think that, so as far as that goes, and then I think people have become more aware, have greater mental health awareness too. I mean, generally people will come in with their own diagnosis, which of course we have to, figure out if that's correct, and take,
Right.
but generally they've got some anxiety and depression. I mean, people are more savvy as to what's going on with them, and they're more, so I think that's a positive to
Mm,
change as well, the increase in
right.
that. awareness.
Do you think the virtual meetings are as effective as, or have they become just as effective as being one-on-one and sitting in front of the person?
Well, I think they can be. I mean, you can do hypnosis. I mean, the person, instead of laying on your couch, can be laying on their bed, for example, right? um, or their recliner. Uh, and the only thing that and even deep things, if I think it's better for them to come at the beginning, if at all possible. Certainly the intake and all the questionnaires, for a little while, I had to ask all these questions, which is all, draining, then to have them check off and also rate and describe in their own words. So that's a little harder, that intake. I really like someone to come in at least, even if they are a city away, if they can come and just meet and greet and then, do their sharing, on the packet,
Hmm.
fill it out. So really get to know them.
Hmm.
But I do think that you can accomplish quite a lot with the, doing telehealth as well.
Hmm. And you feel that you're just as effective as, say, at hypnosis or calming the person if it's virtual? And you mentioned laying in their bed, so you can pretty much use the same, modalities virtually,
Well,
and they're
I was
just as effective?
saying for the hypnosis, generally, some people, not everyone, some people like to recline back in something, and some people actually have a futon and they lay down. So I'm saying it doesn't matter if they're laying on the couch at home versus the couch at my home. But generally, psychotherapy, they would not be. I mean, they're not laying down while we're doing psychotherapy, telehealth,
Hmm.
or even, office stuff. I was just thinking that one thing, just to relax and go into your own meditation, some kind of reclining, back is a good thing when you do that. So I kind of lost what you were asking me. Like, um, what was the question again? I apologize.
So, if you're performing hypnosis, can you still be just as effective virtually as you would be if they were sitting in their office?
Right. I mean, I think it can really help. I mean, I say that just because the people who couldn't get here wanted to
Hmm.
continue doing that. And it's just a small part. I mean, the hypnosis itself suggested might take 10 minutes, 12 minutes or something after
Okay.
they get used to it, because they're used to just going into it. And so hopefully the first several times they've come in and, get that process of relaxing. And then if you follow up and you're doing your session with them and they want to do a little something at the end, a guided imagery, that's fine. I do think that they would still get benefit and they like it from my experience and they want to do it. But I would say they would
Hmm.
pretty much say they like to come in and do it. They would prefer, if, to come in versus a telehealth. But it's better than not having it. So especially if you're trying to do a series of the hypnosis and they couldn't get in that week, you don't want to skip it for the regimen because you want to do it on
I
weekly,
see.
4 to 6 times.
I see. I see.
Mhm.
Do you have any geographical restrictions? If someone, can you work with anyone in all 50 states? Is there any restrictions now?
There are restrictions. There's SIPACT. It means when you get that, which I have, you can work with any states that participate in SIPACT. And
What
not,
does SIPAC stand for? What is that?
I,
SIPAC?
I know that's terrible. I can't think of it this second, but
Okay, no problem.
it's
No
a
problem.
it's an interstate agreement
Okay,
that you
got it.
can that your license will cover you seeing someone in another state. But all the states have not participated. The majority of them have,
Mm,
so you can, but there
mhm.
are several, that you wouldn't be able to see because they haven't agreed to
I
do
see.
interstate agreement. I mean, between
I
state,
see.
yeah.
Right. So you can stay pretty busy if you're able, especially virtually. You can stay pretty busy with clients. And are you pretty busy on a daily basis with clients? Do you ever have a group in the queue that you're just trying to get to, and it's you have those challenging times where you're not able to get to everyone?
Um, if hopefully I can get to them. I try not to run but a few minutes late. But if I, have to, like I had a crisis or someone needed something, I might have to say, that especially if there are telehealth, that's one of the conveniences is that
Mm,
if they're at home and they're not working and they is a telehealth and say like I'm running late, I've had a crisis, can we do it in a half an hour? That has happened before. So, but usually that's not a problem for them if they're retired or whatever. That it seems to work. I mean, you never know. Things I feel like we're provided for, and good is happening, and it just seems to work.
mhm.
I had one poor client whose daughter, the mother had killed the daughter and the other sibling and herself. And he, of course, was terribly depressed, and he would
Mm.
come in and he had a hard time just getting going for a while until we figured out to help, the different things. But he would show up like an hour late every time, practically. And I would tell you that every time the client that was supposed to come would not show up, they would have their car would break down and they would be calling
Really?
saying, I can't get there. And I'm like, I gotcha. We're all good. Okay,
Wow.
we will catch this at the tail end and I will talk to you then. But he always
Mhm.
got his sessions. It's just, provided for. So
Wow,
I
that's
believe in that. I believe in that flow and just to see it and
mhm.
be part of it and let it.
Yeah, I understand that. I understand that as well.
Yes.
In
Go
your
ahead.
practice, in your development from when you started to where you are today, tell us about your toughest, I guess I want to say transition from one step to the other, or is it, getting your office together? What was your kind of your entrepreneurial trek? Talk to us about one of those times you can remember that it was tough in your business for you.
Hmm. Well, I just I don't know. Sometimes it's hard when a client I've had a few incidents where I've had clients that were very happy with their therapy, but like a family member or something who I'd never met, never talked to, never asked me anything would get mad at
Mhm.
me and put something up on social media about me, where they never saw me or and then they would like undermine the therapy that for the client,
I see. Yeah.
interfere.
Yeah.
I would call that the hardest. But it's not really
Mm.
because I don't know, the others have not been that hard. It just flowed, as far as setting it up and going from one. I kind of just go with the flow on what's presented,
Yes.
and kind of move with it. I'm able to do that, so it don't fight it if it's going that way. And worry about it, but then that's hard, especially when you have a client that's doing well, and then somebody comes along and interferes with that and undermines their getting their help. That's the hard thing for me. Mhm.
Yeah. Well, the way you
And
answered that question that I asked regarding any tough transitions or times, you're in your purpose. You are in your purpose, and it
yeah,
just flows because that's what you do. And if it were difficult and you had a lot of tumultuous times, it wouldn't be your gift and you wouldn't be in your purpose. So I
right.
get that answer. I kind of smiled at myself when you were answering. I'm like, this is your gift. So you're not
Well,
going to have a lot of issues.
thank you very much.
Yeah. So we're going to begin to wrap this up. What I like to do, based on our conversation, and I started off by calling you a multifaceted psychologist. Why don't you tell the audience how it is working with you, what they can expect when they pick up the phone, call you, and start to work with you? What is that experience that they will expect to be a part of?
Yes. Well, I mean, I just try to get them in as soon as I possibly can, find out,
Hmm.
how quickly they need to get in, if there was any kind of an emergency that they
Hmm.
really feel like, and
Sure.
then be able to try to work that. Um, and just give them the support to be able to do whatever they need to do, find out about their insurance, and be all ready and not surprised with anything. And then when they come in, as I said, that they get the fun paperwork. They're told before they come in, now when you get here, just come on in, the fun paperwork is sitting out there for you. So they're a little prepared, and let them really express themselves through the paperwork, and then through the interview, that with my 1,000 questions afterwards, to really get to know them. And I guess I'm kind centered, I'm trying to work on what their goals are at all times. But of course, I'm going to have a
Right.
little deeper understanding of what might be interfering, in terms of knowing what certain disorders are, or symptoms are, or certain treatments that are be the appropriate way to
Mhm.
go. But I vary. The second session would be focusing on that. Would be me telling them, well, hey, this was the results of this test you took, or this information, and see, what do you think about that? Does that fit for you? And if it does, can we work on that? Can we make that one of our goals in addition to your goals, and start getting our plans together,
Yeah,
and educating them some about the therapy and what we'll be doing the second
that's
time.
awesome.
Yeah.
Yeah, very collaborative. Well,
Yes.
Dr. Ann, thank you so much for your knowledge, your time, and actually giving of yourself on this call today. I
Absolutely.
have not spoken to very many psychologists that have a disposition that you have. So it's a pleasure to talk to you today. I see why you're successful and continued success. This has been Undiscovered Gems. Thank you for watching, and stay tuned for the next show. I'm Charles Smith, and we are out.
We hope you enjoyed this episode of Undiscovered Gems with our host, Charles D. Smith, highlighting today's best and brightest business minds. Brought to you by Pods Entertainment Group.